Welcome all for the recall and revise series. Now we have few questions from immunology module. Dr. Sansi, you want to go ahead with the immunology module? Please read the
Yes,
question
sir.
and try to attempt.
Which of the following statement regarding immunoglobulin is correct? Cannot cross the placenta to the fetus. Comprises one antigen binding site and a site for the binding of complement. Constitutes 25% of all immunoglobulins. Has a Y-shaped molecular structure secreted from T lymphocytes. Sir, option D is correct.
Sorry. So question number one, the answer is D. It has got a Y-shaped molecular structure. IgG is the most abundant hemoglobin in the serum and has characteristic Y-shaped structure consisting of two heavy chains and two light chains. It can cross the placenta and provides passive immunity to the fetus. Option A is incorrect because IgG readily crosses the placenta. Option B is incorrect because IgG has two antigen binding sites. Option C is incorrect because IgG constitutes approximately 75% of serum immunoglobulins, and option E is incorrect because immunoglobulins are secreted by plasma cells derived from B lymphocytes, not the T lymphocytes. Next question, doctor.
Yes, sir. Which of the following vaccines may be administered to HIV positive patient? BCG, measles vaccine, oral polio vaccine, oral typhoid vaccine, yellow fever vaccine. Oral typhoid vaccine, sir. Option D.
No. See, in immunocompromised, generally we don't give live vaccines, but the only vaccine which can be given is a measles. Okay. So measles
Measles.
vaccine, HIV positive patients with adequate immune function may receive the measles vaccine because the benefits generally outweigh the risk. Live vaccines such as BCG, oral polio vaccine, oral typhoid vaccine, and yellow fever vaccines are generally contraindicated in an immunocompromised individuals due to the risk of disseminated infection. Okay, next.
Which of the following statements regarding anaphylaxis is incorrect? Which of the following statement regarding anaphylaxis is incorrect? Causes degranulation of basophils and mast cells, causes eosinophilia, causes urticaria, is mediated by Ig antibody, occurs 24 hours after the initial stimulus. Sir, option E.
That is incorrect. Okay. Occurs after 24 hours after the initial stimulus is wrong. Anaphylaxis is an acute type 1 hypersensitivity reaction mediated by IgE antibodies. It occurs rapidly after exposure to the allergen, usually within minutes. Mast cells and basophils degranulation release histamine and other mediators. Urticaria is common manifestation. Eosinophilia may be associated with allergic condition. A delayed reaction occurring after 24 hours is not a characteristic of anaphylaxis. Next.
Which of the following is contraindication to MMR vaccination? A history of convulsion, an anaphylactic reaction to a previous dose, congenital heart disease, cystic fibrosis, Down syndrome. Sir, option B.
Yes, anaphylactic reaction to the previous dose. Okay. So previous anaphylactic reaction to MMR vaccine or its components is an absolute contraindication to further doses. Conditions such as congenital heart disease, cystic fibrosis, Down syndrome, or history of convulsions are not contraindications to MMR vaccination. Next.
Which of the following statement is correct regarding the T cell response to antigen? Correct. T cell response to antigen. A process of affinity maturation of the T cell receptor occurs. Cooperation with other cell types is required for the T cell recognition of antigen. Gamma or delta T cells respond to antigen presented in association with MHC class II molecule. Intact antigen is presented in association with self-MHC molecule. Interaction of the T cell receptors with an antigen MHC complex alone fully activates a resting T cell. Sir, option A.
Which of the following statement is correct regarding the
Correct.
T cell response to antigen? Okay. So option B is correct. Cooperation with other cell types is required for T cell recognition of antigen. T cell activation requires antigen presentation by antigen presenting cells together with co-stimulatory signals. Therefore, cooperation with the other immune cells is essential. Affinity maturation occurs in B cells, not T cells. Most T cells recognize processed antigen peptides, not intact antigen. Then full T cell activation requires additional co-stimulatory signals beyond TCR MSC interaction, and gamma delta T cells have unique antigen recognition pathways and are not classically MSC2 restricted. Okay, so these were a few questions from immunology. Read the hypersensitivity topic very well. Okay, so that finishes today's topic on
Yes, sir.
hypersensitivity immunology.